Well, good afternoon, and welcome to the third floor conference room of Waco City Hall. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'll be your host for this weekly press conference that we have. Today we have a good group of panelists, and we have our new mayor. But before I introduce anybody, I want to tell everybody kind of how we're going to proceed. Downstairs in our studio, we have an American Sign Language interpretation going on that you'll see inserted in the right-hand corner of the picture, because we want to make sure everybody in this whole community knows what we're saying. And also, we're recording a complete Spanish translation of everything that's being said, so that later this afternoon at 4:30, we'll be playing back a full video of this, but we'll lay the audio translation in Spanish over that, so all of our Spanish-speaking population will be able to hear it as well. Typically, we have our City Council District 2 Representative Hector Sabito to introduce that, but he was not able to be with us today, so we do have Esmeralda Hudson, who is our City Secretary. And Esmeralda, if you don't mind, would you please invite our Spanish-speaking audience to be a part of our replay this afternoon at 4:30 in Spanish.
I don't mind at all. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido de inglés en la video, y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de la tarde. Puedes ver la conferencia de prensa en el canal 10 o para internet en vivo en wcc.tv. Larry and everyone, that's all I have.
Thank you so much, Esmeralda, for being a part of it and doing that invitation. Joining me today virtually, we're doing this whole thing virtually in the conference room up here. We actually only have 3 people, and we're all 3 wearing masks because we believe in what's being said, and we're social distancing and abiding by the rules that have been established that we hope are going to make a difference in COVID-19. Joining us today is our brand new mayor, Dylan Meek, and he will be conducting most of this interview and directing it anyway. And Dylan, we are glad to have you, first of all, as our mayor and a part of our press conference today. Joining us also, we missed you last week, Judge Scott Felton from the McLennan County area, serving that whole area. We also have Dr. Jackson Griggs, CEO of Family Health Center, Dr. Brian Becker, Chief Medical Officer from Ascension Providence, and Dr. Mark Lyson with Baylor Scott & White. Gentlemen, I'll appreciate everybody here. Great information I know you all have. And we're going to go through the process like we normally have. I'm going to ask everybody to do an opening statement. We'll go in the order of Dr. Jackson first, followed by Dr. Becker, Dr. Lyson, Judge Felton, and then our Mayor Dylan Meek. And then we'll open it for the questions that we have received. Then we have 3 media representatives on the phone on the Zoom call, and we will ask them to ask a question each. Then we'll have a closing statement. So let's get started. We'll start with our opening statements and start with Dr. Jackson Griggs from the Waco Family Health Center.
Thank you, Larry, and thank you, Mayor Meek and Judge Felton. Incidentally, comments about Mayor Meek, he and I have already begun to meet about the COVID pandemic, and he has just an excellent intellect. I'm really just thrilled that he is our new mayor. He understands the critical issues pertaining to COVID and is asking all the right questions. I'm just excited for his leadership. So thank you for having me back. I'm going to start with our numbers, just like I have in times past. Worldwide, we have seen almost 56 million cases of coronavirus and over 1.3 million deaths to date. In the United States, there's been a cumulative total of 11 million novel coronavirus cases and just shy of 250,000 deaths from COVID-19. Texas has seen 1 million confirmed cases and 19,000 fatalities. Now, McLennan County data as of yesterday afternoon, we've had a total number of confirmed cases of 12,761, 1,296 of which are currently active. As of yesterday afternoon, the Public Health District received notification of 189 new cases of coronavirus. If you're tracking the covidwaco.com website, you may have noticed that yesterday we had 249 new cases to report. That's the second highest number of cases in a single day that we have seen in the history of this pandemic. There are 80 people currently hospitalized with COVID-19. That's the highest number of hospitalizations we have seen during the pandemic. 13% of those patients currently hospitalized with COVID-19 are receiving ventilator support. We have 4 additional deaths to report, bringing the total number of deaths to 174 in McLennan County due to COVID-19. Among the community-wide surge testing, the total tests to date are 21,117, and the positivity rate among those tests, remember these are symptomatic and asymptomatic participants, is 8.5%. 8.5% positivity for the surge testing. Within elder care facilities, currently there are 16 facility outbreaks. There are 41 active cases in those facilities, and to date, we've seen 71 fatalities in elder care facilities. There's only 1 active case in the county jail. There aren't any identified church clusters at this moment in time. There are 15 independent school districts and 3 private schools that are reporting cases on campus. That accounts for 47 individual campuses. Within schools, there are 179 active cases. 124 of those are students and 55 staff. 11 schools are currently closed, and those 11 schools are, as far as I'm aware, slated to open after Thanksgiving. I'm going to pivot now and share some slides to describe our new case counts. And I'll start, as I had before, with the case counts across the entire country. These are new cases per day per 100,000 population over a 7-day rolling average. And in making these slides, I had to change the y-axis scale because cases were getting close to being off my previous chart, and just sort of a sobering moment when you're realizing you're having to change the scale because numbers are skyrocketing. So here we have the United States currently at 43 new cases per day per 100,000 in population. The state of Texas, we're at 35 new cases per day per 100,000 in population. And that's per the Department of State Health Services report. And here we are in McLennan County now at 61 new cases per day per 100,000 in population. To review, community spread is less than 10 cases. 10 to 25 new cases per day per 100,000 is accelerated spread, and over 25 new cases is described as the tipping point, because it's where we see that exponential spread. And we don't have any evidence at this point that that the growth in numbers is slowing down. So we are on the steepest part of the curve of that spread. And we're coming into a holiday season where historically families have gotten together, friends have gotten together to meet and share a meal together. As I mentioned last week, now is a uniquely dangerous time to meet with members outside your household. I'm concerned. I'm deeply worried that with this degree of prevalence of virus in our community that for some families, getting together for a meal could prove fatal to loved ones. So I tried to put together some guidance around Thanksgiving and other holidays. Oh, you know what? I'm skipping ahead. Let me share that guidance first because it's on my mind, and then I'll come back to positivity rate. First and foremost, if possible, just enjoy the holidays with only those within your household. If you want to connect with others, do so virtually, but not in person. However, if you really must get together in person with non-household members, and I know that a lot of those in our community are really determined to do so. So I thought that at least perhaps we could share some guidance how to do it as safely as possible. So here's that guidance. First, invite as few people as you're willing. Keep in mind that smaller is safer. Set up tables outside and spread the tables apart. Keep chairs at the table at least 6 feet apart from each other. Designate the most respected voice of authority in the group to start off with an announcement of health behavior expectations. Ask that person to be the enforcer to keep everyone safe. The group needs a leader who can say, hey, while we're getting together today, your health is so important. We have to all be mindful of keeping our masks on until we're eating. We've got to all be careful not to be within 6 feet of each other. If you're hosting, provide masks. Remember that somebody might show up without one. Don't unmask until it's time to eat, and right after you finish a meal, remask. For their own safety, prohibit those who are health vulnerable from joining the group. Again, what has the potential to be, a joyful holiday could end in tragedy otherwise. Have hand sanitizer available at every table, and ask guests not to attend if they have any cold symptoms, fever, cough, shortness of breath, body aches, chills, or other viral symptoms. Remember, if you are hosting, it's a big responsibility. Those who are coming to your event really do need guidance. Please keep these guidelines in mind. Go back real quick just to share positivity rate, because I skipped over this before. Here we are in McLennan County currently with a positivity rate of 13%, and positivity rate in the state of Texas, 10%. Remember, mitigation or slowing the spread of the virus is 10% or less, and suppression is 3% or less. The effective reproduction rate that we've shared consistently since the beginning of the pandemic for Texas, 1.14, and for McLennan County, 1.17. And that concludes my report.
Thank you, Dr. Griggs. Excellent information. Now let's go to Dr. Brian Becker with Ascension Providence. Dr. Becker?
Larry, thank you. Welcome, Mayor Meek, and thank you for the opportunity to participate in today's press conference. I greatly appreciate that opportunity. I just have a few comments. We continue to experience significant numbers of hospitalizations secondary to COVID. We've talked over the previous weeks of at least anecdotally what I see at Ascension Providence, and you've heard me say over the last 3 weeks, numbers have gone from a daily census of 20 to 30s, and now in the last week it's been low to mid 40s for most of the last 7 days. In general, we are seeing a lower rate of ICU usage. So it's more of I'm sick, I need to be in a hospital bed, but less in the ICU. So that's That's a nice trend to see. Hospitalizations have also been somewhat shorter. So we do still have rather lengthy course of care for some, but we are having more patients who come in and spend 2 or 3 days and are discharged home for the rest of their care. We haven't seen a real significant change in medical management of these patients, and that's been pretty consistent now for some time in the tools that we have to manage most of these patients. We do currently have adequate beds, supplies, including PPE, and staff. And as Jackson just said, I would encourage members of our community to engage in a Thanksgiving celebration in a safe fashion. So look forward to questions. Thank you, Larry.
Thank you, Dr. Becker. Let's go to Dr. Mark Lyson with Baylor Scott and White Hillcrest. Dr. Lyson.
Good afternoon. Thanks for having me back. So several comments. You know, we are seeing a big uptick in the disease, and we're seeing more hospitalizations and a lot more deaths in our community. And we're at a stage now where just about everyone knows someone who's had COVID. And I would wager that most people probably know of someone who's died from COVID, with more than 12,000, almost 13,000 cases in our county, and almost 190 deaths just in a matter of about 8 months now. So that is sobering. And I do want to remind people that death is not the only tragedy that happens when COVID strikes. It can make people very sick. It can be debilitating, and can cause great loss of income as you're sick for several weeks. I do want to remind people that several weeks ago on this program, I had talked about my nephew who's 16. He doesn't live in our community, but he had contracted COVID while at a flea market. And so he was outside, so he thought it was safe to not wear a mask. But I don't know the exact details of his behavior, but he did not think he did anything risky. But I'm sure he went to a stall or a bathroom or something without a mask on, and somehow got COVID 2 days later, started having symptoms. And so he was out for the 14 required days, but he was still so sick that he wasn't able to go back to school for 21 days. And about day 14, he was so weak and so short of breath that even just walking down the stairs in his home completely exhausted him and made his heart race, and he was panting, just trying to catch his breath. So you can imagine for a 16-year-old athlete, high school boy, being that sick, what it can do to people who aren't so fit. And that's what it does. So it doesn't just kill people, but it makes them very, very sick. And then I also want to remind people that, you know, you are contagious in those first few days before you even develop symptoms. And that's the part where people think, well, I'm fine. I can have people over. Well, that is a risk. And I mentioned before, and I'll mention again, that, you know, routinely I'll ask my patients, is anyone else at home sick, or do you know how you contracted COVID? Who else is sick with COVID that you know? And oftentimes patients will tell me, I don't have any clue as to how I got this. And yet they have it. And so someone has done something where they weren't safe or cautious. And so as Dr. Griggs mentioned, with Thanksgiving coming up, we want to be really careful. We are already seeing I hate to use the word explosion, but a big uptick in cases and hospitalizations. And while we do have capacity right now to take care of patients, we don't want to take care of patients that we don't have to take care of. If we can prevent this, let's work together. Let's be safe. Let's be wise. And also, just not just for Thanksgiving and other holidays, but if you're eating at a restaurant or in an environment where there's other people around, put your mask back on when you're done. You can continue to socialize, but you know you've taken a drink, put the mask back on. I've heard people joke that you know, as long as they're sipping, they don't put their mask back on, and that sipping can last for 20 or 30 minutes. Well, funny, but not smart. So I'll look forward to taking some questions as we get going, but I did want to kind of mention those points and just remind people that this is real. This is serious.
Thank you, Dr. Lyson. Let's go to McLennan County Judge Scott Felton. Judge?
Good afternoon. As Larry mentioned, it's been a few weeks since I've been on this program. And of course, I was hoping that when I came back, the numbers would be much improved, but it's just the opposite from that. They're vastly larger and more significant than I had hoped, for sure. efforts that are going on in the community right now, and Mayor Meek, welcome to the fray that we're in right now, and we look forward to working with you on this. But with the leadership of the city of Waco, there's a vast amount of testing going on by the virtue of the state of Texas providing a lot of tests for us in our community. And a couple of weeks ago, I know Dr. Lyson talked about some friends or relatives that went hunting, and that one infected the other one with COVID. And so my point of this story is how easy this testing is to get done. 5 of us were going to our hunting lease a couple of weeks ago. That's the reason why I was gone. And we decided all to get tested. And we were leaving Sunday, and we went through drive-through test. It took no time to do it. It was so easy. And it was the saliva, spit in the cup deal. And by the time on Sunday afternoon, by the time we got to the lease, we already knew that we were negative. And so we could relax. So we went in different vehicles because we were going different places. But I want to make the point that it is easy to do this. And it is helpful in the community when there's so many that are asymptomatic that do not know that they're sick, that just going to take the test, you feel like it's not necessary. But what if you're asymptomatic and didn't know it, and you found out that you were positive, and you're going to be around some people, you could save people illness from being ill and also from death. Hopefully these numbers start turning the other way before too long, but I'm hoping and praying. And, Thanksgiving's coming up, and so I'm thankful that we've got a lot of people working hard on this, a lot of volunteers, a lot of paid professionals, doctors, nurses, people like Mayor Meek and city staff, and some of our staff too that's working on it. So I am thankful for that. I look forward to answering any questions that might come up.
Thank you, Judge. Now let's move to our new mayor for the city of Waco, Dylan Meek. Mayor Meek.
Good afternoon. Mayor Deaver and the other leaders on this call who have participated in these news conferences have set a high standard for clear, concise, credible, and timely communications. I want to thank Mayor Deaver for his leadership, and I also want to thank Dr. Lyson, Dr. Becker, Dr. Griggs, Judge Felton, as well as Larry, Esmeralda, and other city staff members for their work on these press conferences. As the Waco mayor, I will be working with our city staff to continue this policy of working with our community leaders, medical experts, and fellow elected officials to make sure that our community is fully informed as we work to address the COVID-19 virus. This is a time for hope. With the announcement of 2 potentially highly effective vaccines that are in the late stages of testing. But as we approach the holidays, it is not a time to let our guard down or to reduce our community-wide commitment to best practices until the vaccine becomes available. Waco is already at work to ensure that we are prepared for vaccinations. And this press conference will be one place to tune in, along with covidwaco.com and other social media platforms, to make sure that our community can be informed on how vaccines will be approved and distributed as we move forward. Now let's look at the data. Esmeralda, can you pull up the PowerPoint, please? Thanks. The first slide is our cumulative cases, which has passed 12,572. If you go to the next slide, please. This is a look at new cases per day. The blue column reflect the number of cases reported each day, while the red line shows the 7-day rolling average of new cases. We went from an average of 68 cases per day back on October 28th to an average of 166 cases per day yesterday. Of note, as Dr. Griggs said, there were 249 new cases yesterday alone. This rise in cases just before the holiday season is alarming, as the doctors on this call have referenced. If you go to the next slide, please. The blue line on this chart is the number of hospitalized patients, and the orange line is the number of patients on ventilators. We have 69 hospitalized patients as of yesterday, with 14 patients on ventilators. Fortunately, hospitalized patients as well as patients requiring ventilators have not increased, but based on history, that is likely to follow. Remember, hospitalizations, ventilator use, and deaths are trailing indicators. Next slide, please. We lost 5 more McLennan County residents to this virus since the last week's press conference. We now have a total of 170 of our friends and neighbors lost to this pandemic. For the sake of those community members that have a higher risk of severe illness and death from this virus, whether family members that we care for, or to our coworkers, or to those we pass in the grocery store, we must exercise caution as we go into the Thanksgiving holiday. We are a country that desires to celebrate Thanksgiving in a time of thankfulness with those that we love the most. And we're a country that believes strongly in our right to make our own decisions, and I believe that. But we must recognize that these decisions can affect others. We must continue to remember that we can carry and transmit this virus without experiencing the symptoms, as the doctors on this press conference have stated already. So as you make your Thanksgiving plans, please carefully consider all the risk to the people that you care about, especially those most vulnerable to serious illness and death. Data shows that as this virus spreads, hospitalization rates increase. And as we've talked about, while our ICU capacity is in strong shape now, that is not unlimited. And we've seen in other communities here in Texas, hospitals can reach capacity. Lastly, I'd like to say some closing remarks. Just this first time for this first press conference. And as I've already said, I would like to thank Mayor Deaver for his selfless leadership. We're so blessed to have had him as our mayor. Waco is a better place if Wacoans are healthy. For all public health matters, including COVID-19, my commitment as the new mayor is to continue to convene community leaders, local doctors, and medical experts to provide science-based recommendations to our city leaders and the public with transparency. As a reminder, at the present time, Texas mayors and local governments have almost no policymaking authority. Governor Abbott has implemented and has control of the regulations and mandates, from masks to closures. In the last 8 months, we have learned so much about how to take precautions against this virus. Smart and safe behavior allows us to go about our lives without fear. And I encourage us to exercise wisdom in the days ahead. My prayers are for our city, and my confidence is that good days are ahead. We'll now turn it back to Larry for some questions.
Okay, thank you, Mayor Meek, and thank you all. Let's go to the questions. We have a number of them here. This first question is really multiple part, but it talks about vaccines. I'm going to read it the way I have it written here. With the recent announcement of possible successful vaccines against the coronavirus, what would a rough local timeline for acquisition and administration look like? Would coordination be through the state and federal government? Are there priorities in who gets the vaccine? And will county residents need to continue masking and distancing throughout the spring? A multiple bunch of questions. Who wants to grab that one?
Dr. Griggs, why don't you take a stab at starting out with that one? And as usual, if anyone wants to jump in, please do so.
Absolutely. First, let me kind of contextualize the reports, the positive news that we've received from both Pfizer and Moderna, the two biotech companies, big pharma companies, actually that have shared some good news about the vaccines. On November 9th, Pfizer announced interim efficacy analysis on its phase 3 study after evaluating 94 individuals who either received placebo or the study vaccine to coronavirus. They announced the vaccine had an efficacy of 90%, and then, not to be outdone, Moderna announced 2 days ago that in their phase 3 trials, 95 cases had been evaluated with a vaccine efficacy of 94.5%. So both reports pointed out that there were no serious side effects to the vaccine. So what does this actually mean in terms of the questions that Larry posed? First, this is preliminary good news, and I say preliminary. I'll explain in just a moment, but maybe the good news first. So the seasonal influenza vaccine, when there's a good match, it is 40 to 60% effective. So if indeed the coronavirus vaccine proves to be more than 90% effective, that would be extraordinary. But again, I said preliminary because what was shared was a press release. So this is the company who is sharing as a business some preliminary information with the public. What this is not is peer-reviewed, published literature that can be evaluated by the scientific community for statistical and scientific rigor. So it would be too soon for exuberant celebration, but indeed we are very hopeful with this preliminary news. In regard to the timeline question, most vaccine experts suggest the public won't have access to the vaccine until probably February. That would be an early estimate. A later estimate, if there were hurdles or obstacles that could occur, it may be as late as middle summer before we would see access to a vaccine. However, with these new reports, there are some vaccine experts who are beginning to suggest that priority populations may receive vaccines as early as the end of January. So the priority populations, who are those individuals? So the Department of State Health Services for Texas has released a draft COVID-19 vaccination plan for the state, and it says, I'm gonna actually read a quote here to you from that report. It says, final decisions are being made about use of initially available supplies of COVID-19 vaccines. These decisions will be partially informed by the proven efficacy of the vaccines coming out of phase 3 trials, but populations of focus for initial COVID vaccination may include, and then they list the priority populations, healthcare personnel likely to be exposed to, or those who treat people with COVID-19, people at increased risk for severe illness from COVID-19, including those with underlying medical conditions, and people 65 years of age or older, and then 3 other vulnerable frontline workers. So those are the 3 priority populations as identified by Texas Department of State Health Services. And then finally, the last portion of the series of questions was about masking, and it was, when can we be done with masking and social distancing, and will it persist through the spring? And the answer is yes. I know that it's hard to hear, but I would agree with Dr. Fauci that we will likely need to continue masking through the duration of 2021. I would go ahead and set that kind of internal expectation, and if we're able to stop masking before the end of 2021, we'll all celebrate. But I think that right now, having that expectation is probably appropriate.
Okay, that's a lot of good answers for a lot of questions that were thrown at you. All right, last week
Larry,
there was...
do you mind if I throw in
Go,
one or
you
two
bet.
more
Please do.
comments? It's nothing to disagree with what Dr. Griggs said. That's all fantastic and accurate. There's still a lot we don't know. And while we are very hopeful and this information is very promising, what we don't know yet is long-term efficacy. We don't know what patients were studied. And there are some difficulties with getting the vaccines to people. It has to be handled in a certain manner, and it's very temperamental. And so it has to be stored and transported at negative 100 degrees Fahrenheit, which makes some areas going to be a little difficult to get that to. But yes, it is very promising, very encouraging information. And with what we currently know, I too don't have any hesitation to get in line when the vaccine's available and hope to receive it myself. I know it's been a question we've had multiple times on this program.
Okay, very good. Okay, last week there was an announcement that there was a drug been proven to treat the virus and lessen the severity of COVID if contracted. What are your thoughts on this discovery?
Dr. Becker, you want to jump on that one?
Oh, you bet. So that's a somewhat vague question. So there's a new drug announced pretty regularly, and so I'll take a shot at one, and I believe Dr. Lyson's going to follow up with another as well. So I think most people have heard of monoclonal antibodies, and recently one, I'm going to say this, bamlanivimab, was approved under emergency use authorization for treatment of mild to moderate COVID infections. And mild to moderate meaning someone who's not hospitalized. It is an antibody that is overly simplified, but attaches itself to the virus itself and prevents entry into the cell, which in turn causes symptomatic infection for an individual. So that drug is now approved for limited use. It certainly doesn't apply to all patients. It's not, all patients won't be a candidate for it. Much like the vaccine, the data on it is pretty sparse. It does prevent hospitalization in some portion of patients who receive that drug. It is also in pretty limited, pretty limited supply. So a bit over 5,000 doses will be delivered across the state of Texas. It's a pretty small portion of medicine for a large population of people. So while we see new medicines coming out, they are trickling in on the front end. If proven to be effective, then obviously production would ramp up. There's a second similar drug that is on the near horizon, also a monoclonal antibody. So yes, there's some truth to there are some new medications that we are beginning to try. They do have some proven efficacy, but they are in limited supply. So I think that's at least a shot at monoclonal antibodies. Dr. Lyson, do you have another?
Yeah, and just one more comment on that medication. I too don't know how to pronounce it. I can spell it, but it's a tough one. But we don't know what it's going to cost. The portions that are allotted, you said 5,000 for the entire state right now. That was purchased by the federal government, then given to states, and the states are going to then divvy it out and spread it around the state. But eventually, when that medication becomes more widely available, it will have a price tag. And what that price tag is, don't know yet. But it is, again, I want to emphasize for mild to moderate cases. Those are going to be cases where you're sick, you've been diagnosed with the disease, and maybe you have higher risk factors for a poor outcome, or you have immunocompromised health. And so then that would be available to you as an outpatient treatment. It's not going to be a treatment for people who are very sick in the hospital or even in the ICU. A second medication, which has been studied for several years in other lung diseases, but has not shown efficacy, but is now being shown potentially to show efficacy in COVID, is interferon beta 1A. That was just published in The Lancet 5 days ago. Very small study, less than 100 patients. And half of those patients were the treatment arm, the other half was a placebo group. It did show some improvement. In fact, it showed a doubling, or I guess a lessening, let me say it that way, a lessening by 50% of a poor outcome. I have no idea what this medication costs. I tried looking through the article and trying to find what the dose was. No idea what the dose was, but a similar dosing of that medication costs for a single dose $6,500. And the way this study was done, it was a 14-day treatment course given through a nebulizer. So that means it's aerosolized, so you breathe it in. So I think even if the medication were to cost a third of that price, it's really cost prohibitive. So I don't see that drug really being available today or next week or next month. But it did show some promise.
Okay, looks like the next question was centered around our COVIDwaco.com dashboard that says the dashboard shows 50 of 54 ICU beds are occupied. What happens when there are no beds left, and how many of those are COVID patients?
I'll throw that to Dr. Becker again, and then again, any other participants want to jump in, feel free to.
Okay. This is a question that I think we saw a fair amount when we saw surges in the past. People start to get a little bit more concerned about availability of hospital beds and ICU beds. So it's a natural question for us to see. The 54 ICU beds that you see in the dashboard really reflect the beds that have always been in place at both Hillcrest and at Ascension Providence. They are beds that are licensed as ICU beds. They are beds that function as ICU beds in any normal state. And so that's those beds. And when we talk about there being 50 patients in there, in a normal flu season, we may see both of our ICUs full. So I think important to recognize that that's a fairly normal state. On top of that, both facilities have developed surge plans, capacity beyond those 54 beds. And that in that same report, that same dashboard is recorded as 96 beds. So we can almost double the capacity of our ICU beds given a need. And it's not just physical space, it's also it's staff, it's equipment, nursing staff and physicians are equally important as a physical place to lay down. And that's oftentimes more difficult to come by than the bed itself. So I think important to recognize that the 54 beds are a normal state. We both across our two facilities can surge to almost double that amount. And not uncommon in a normal flu season for us to see capacities in our ICUs.
Okay.
Yeah, that was eloquent. I wouldn't have anything else to add. Agreed.
All right, sounds good. How has treatment of COVID hospitalizations changed with time and experience, and are hospitalization periods shorter and more successful?
Dr. Lyson, do you want to take that one?
You bet. And Dr. Becker answered some of those questions, but I'll certainly repeat and elaborate a little bit. So in his opening comments, he said exactly what's been my experience. We are seeing a lot more patients coming with COVID and having shorter length of stay. We are seeing fewer patients progress to critical status and to full life support, which is wonderful because when patients do make that progression onto life support, it's a protracted illness. And they can be on the ventilator for 2 and 3 weeks following that transition. But yes, we are seeing patients coming, having shorter lengths of stay, patients leaving the hospital in 2-3 days. Not always. It's oftentimes patients are there for a week or longer, but we are seeing some great successes in that manner. And then the other question was, have treatment options changed? Dr. Becker also mentioned that they haven't. So we've got a pretty stable arsenal of medications and treatments available to us. Those have been pretty consistent for the past probably 5 or 6 months. And then we've already kind of highlighted some emerging therapies. Those aren't yet mainstream or in use, but I expect that in a few months, maybe we'll even have additional treatment options. I do want to highlight one treatment option that we've discussed in this program before, and that's convalescent plasma. Plasma seems to be, in my opinion, in my experience, the most effective treatment we have in helping someone who's got a moderate to severe illness. And what's wonderful about that is it works. It definitely works, but it's dependent upon people making a donation. So this is my plea, again, for people who have had COVID, the COVID illness, who have recovered or convalesced. And that's why it's called convalescent plasma. So someone who's had COVID and has recovered, then a week or 2 weeks later donates their plasma, which has the antibodies, which is just like this other medication we've been discussing. It is this antibody that binds onto the virus, inactivating it and alerting your immune system that this is an enemy. So you can save 1, 2, or 3 other people's lives just by donating plasma. So that's as easy as calling Carter Blood Bank or another blood bank in the area and making that donation. So we are short on some blood types, B and AB in particular, but any blood type is welcome and needed.
Okay, I'm going to jump around just a little bit here. We're going to try to wrap up here the question part pretty quickly. If people in bars or clubs are not following the COVID protocol and are requiring masks be worn, do I call the number of the COVID Waco website or Waco Police? And if I do report it, will they be issued a citation? Will it be issued to the business or to the individual?
Thanks, Larry. If people have a complaint about a specific location failing to follow the governor's order requiring masks, they should call the number on the COVID Waco website. If there's a situation that is after normal hours and they feel that a police response is better suited, such as maybe a large outdoor neighborhood party, then they can call the police department at our non-emergency number, which is 254-750-7500. Regardless, whomever responds will attempt to evaluate whether violations are occurring, and if enforceable issues are occurring, they will seek to gain voluntary compliance and will issue warnings before taking any enforcement action resulting in a citation.
Okay. And our final question is, the state shows the COVID hospitalization percentage was 20.2 as of Monday. Given that, how close is the county to tighter restrictions?
Judge Felton, do you want to start with that?
Yeah, and I think those numbers are not correct. They used the wrong calculation because we get these numbers every day. And it's as of this morning, our numbers are right at 14.5. Which is under the 15, but our trend is it looks like it'll take us over that number here in the next next few days, more than likely. But it's actually the amount of COVID patients divided by the amount of beds available, and those beds have to be qualifying beds that are calculated. This comes from the Heart of Texas Regional Advisory Committee, or hot rack as we call it, and it's a combination of McLennan County with the adjoining counties around it that are used in that calculation. Of course, the hospitals are almost totally in McLennan County, but we do care for people in the adjoining counties that come here for treatment.
Okay, let's end our questioning on that, and let's now go to our registered media representatives. We have 3 representatives on our call today. We have Jasmine Caldwell from KCEN Channel 6. We have Jasmine Geske from KWTX News 10. And we have Karl Hoover from the Waco Tribune Herald. So we'll go to each one individually, ask one question, and we'll hopefully try to do 2 rounds of questions. And we'll go to Jasmine Caldwell first. Jasmine, are you on the line? If you will, please unmute and ask your question.
Yes, I'm here. Can you hear me?
Sure do. Go right ahead.
Okay. Do you think the state needs to issue a shutdown for bars and lower restaurant capacity like they did in the summer?
Jackson, Dr. Griggs, do you want to take that question?
Yes, I'm happy to. And remember, Jasmine, that I'm going to answer this from a physician standpoint. In my hierarchy of values, I am going to advocate for whatever policy level mandates can slow the spread of infection and save lives. And certainly at this point, given how high our case counts are and the fact that we're in a phase of exponential spread, I would be delighted if there were some mandates put into place that that closed bars and that restricted capacity in restaurants. I have friends who own small businesses, and I know that is really a kind of a terrifying prospect for them. But I think right now we're talking about a life and death issue. So my vote would be, if I had one, it would be on the side of more restrictions at this particular moment of exploding case counts.
Okay. All right, Jasmine, we'll be back with you in a minute. Jasmine Geske from KWTX News 10. Robin, are you on the line?
Yes, I am. Can you guys hear me?
Yes, go ahead.
Okay, perfect. Real quick, I just wanted to ask, I know that Mayor Meek had talked about how the city was already making preparations for the distribution of vaccines should, we get, the vaccine here in Waco. What kind of preparations are the city and the county making as far as the rollout of a vaccine, even though it's several months away?
I'll start with that, but I'd like anyone else to jump on and add anything that might be necessary. Right now, as has been discussed on this press conference, there's so much that we're still learning about the vaccine. But what I can say is that our local health district, as well as our medical experts and professionals, are all working in collaboration along with state leadership to make sure that we are preparing appropriately. Again, there's so much that we're learning, but what we're trying to do is track with information as it comes out and make sure that as we do learn more, we'll be prepared to act. But at this time, we're still learning much information. Is there anything else that anyone else would add to that?
Okay. All right. Thank you, Robin. We'll be back with you in a moment. Karl Hoover from the Waco Tribune-Herald. Karl, are you on the line?
Yes. Can you hear me?
Yes, I do. Go ahead.
Okay. We've had a number of school campuses close in the last week. Will be closed through Thanksgiving. You have Baylor. Once they finish classes this week, those students will be going home. MCC students, the same sort of thing. Will the absence of that population change anything like what we're seeing with the number of new cases and the rising rates?
Yeah, Karl, I think that based on my understanding, the Thanksgiving holiday, I think, is really going to be a greater potential leading indicator to this. I think that that is really the opportunity that's in front of us where an event that could result in an increase in viruses. And just to echo the caution that has been communicated during this press conference already in regards to that upcoming holiday. Dr. Lyson, do you have anything that you'd add to that?
No, I don't think Baylor, and correct me if I'm wrong on these numbers, but I think Baylor's numbers have been pretty good of late. So they're not really contributing to our numbers, and it's a separate population. So again, getting back to Thanksgiving and mingling of people, and maybe it's their return that could be significant, but at the moment it's not a big player in our numbers.
Thanks.
Okay, thank you. Karl, we'll be back with you. Jasmine, are you on the line still? If so, you have one more question for us?
Yeah. Is there or will there, or is the city considering an order to restrict those large gatherings for Thanksgiving?
I'll fill that. As I mentioned earlier, we have almost zero regulatory or policymaking control at the local government level or at the city level. The governor has that control right now, from the mask mandate to restrictions like closures or restrictions on Thanksgiving gatherings. And so at this time, the local government doesn't have the authority to implement any restrictions.
Okay, thank you, Jasmine. Robin Geske from KWTX News 10, you have another question?
I do. I was curious to see if anyone had seen, I haven't seen very much research done on the efficacy of the vaccines in children. I know that a lot of people have talked about, that's kind of one way to keep the outbreaks down in schools. Is there any information out there about, research done on the vaccine on children that anyone knows about?
Any of our
yeah, I'll give it a swing. I read the press releases that came out from Pfizer and Moderna, and while they did make mention that the groups were ethnically diverse, who were in the in those that that they were reporting on, I don't believe that they included any pediatric population cases. Usually, those vaccines are smaller in terms of the aliquot of medicine, the amount of actual vaccine in the injection, and sometimes they are different vaccines in terms of the the carrier molecules, so the non-vaccine portion of the fluid. And I just haven't heard anything about about vaccinating the pediatric population and how they will modify the vaccine in order to meet that population. So I don't think we have that data yet. I don't remember it specifically calling out kids, and the vaccine constitution is a little different for kids in some cases, and it may end up playing out in this case the same way. So Dr. Lyson, Dr. Becker, have y'all read anything about the population?
Yeah, you bet. So until they actually release this as a study where we can see more about the study details, the methods, who was included, long-term efficacy, we really can't answer that question. What I would say, though, is that in general, younger children tend to respond better to vaccines than older patients do. And that's because their immune systems are still young and naive and malleable. And so I do see a definite benefit to vaccinating the young children, but they're the lower risk population for a poor outcome. And so we really want to focus, in my mind, more on the older population who, age over 65, who are having poorer outcomes, and death rates are higher in that population than the pediatric. However, I do totally understand that the younger population can contract and can spread it to grandparents and that kind of thing. But again, the original question, getting back to, we just don't know if they were studied at all.
Okay, thank you, Robin. Did anyone else have a comment about that? I didn't want to interrupt. Okay. Karl Hoover at the Waco Trib, you have a final question?
Yes, a lot of our attention has been on hospitals where the more serious COVID cases go and the stress on those systems. But I was wondering, are other parts of our healthcare systems seeing an increase from COVID survivors, such as, say, rehab work or extended treatments, follow-up visits with doctors? Are any of those seeing an increase from just the people who've had it but have not had an extra serious case that required, say, an ICU bed?
Any of our doctors on the call seen any of that?
Karl, I don't have any data on that. I think what Dr. Becker has mentioned on multiple press conferences, the highest concern right now in terms of the population who's seeking outpatient or ambulatory clinic-based care is that those with chronic medical illnesses have been reluctant to be seen during this season. And so we're seeing higher numbers of exacerbations of their chronic disease. So if you, for example, have chronic heart failure and you're not being seen on a routine basis, then having a flare-up from that heart failure is more likely. The same is true of a variety of other chronic conditions. Without routine primary care, we see a higher incidence of avoidable hospitalization and avoidable emergency department use. So I didn't answer the question that you offered me, but I did want you to know kind of where our concern right now is focused in terms of the clinic realities as far as my vantage point is. Other thoughts from Dr. Lyson, Dr. Becker?
Yeah, and to underscore what Dr. Griggs said, it's not that the system is stressed and can't handle the maintenance of those chronic illnesses. It's because the patients themselves are concerned or reluctant to go in, afraid of the risk of getting COVID, and therefore don't get the attention that they need. That's the concern, the problem. And I'm not aware of any areas that are being stressed post-acute care, like rehab or oxygen supply companies or pharmacies, those kinds of things. I'm not getting any notices from pharmacies that they're having difficulty filling the medications for patients or those kinds of things. So I think we're okay.
And I'll approach it from a little bit different angle, and that I think most of those post-acute care sites have tried to alter their processes, much like hospitals have to manage COVID patients. So SNFs and post-acute care units have set up specific COVID units or quarantine units to manage patients that are coming out of a hospital setting and require additional care post-acute. So that's one change that's been put in place in those facilities. In our clinic system, we set up a complex care clinic to manage patients who are COVID positive but aren't requiring a hospitalization or have a chronic condition that needs to be managed, but they are COVID positive. So I think, and I'm sure other hospital systems have done the same. So I think everyone has looked at how can we safely manage a population of patients who are positive for coronavirus, who need other medical conditions addressed in a safe environment for both them and for our other patients. And then the last piece I would add is the tremendous increase in telemedicine and an ability to access our patients, to access their physicians or their provider with questions or concerns, a visit. There's been a huge increase in virtual care that has been quite successful at trying to manage patients and their illnesses.
Okay, I want to thank all three of our media representatives who joined our press conference today. It was always vital that you all are part of this and ask some good questions. Okay, to wrap up now, I'd like to turn it back over to our mayor, new mayor, Dylan Meek, for some final comments. Mayor Meek?
I just wanted to thank the participants of this press conference again. Your time is valuable, you're busy, but the ability for our community to have this information is so important. I've had several people ask me, are you nervous about walking this leadership role at this time? I think what gives me peace is having this great team that we have in this community. The doctors on this call, Judge Felton, our city staff, our public health district, our hospitals. We have a great community of strong leaders who are working collaboratively and together to make smart, wise decisions for our community. I'm thankful to be a part of it. I know that there are brighter days ahead, and I think there was a lot of good advice shared in this press conference that we can heed in expectation for those good times that are coming. So I appreciate everyone's time, and we will see you again soon.
Thank you. Thank you very much, Mayor. And you did good. I know you're a little nervous, but you've handled it just extremely well, and we're proud that you're our mayor, and that's been echoed by the other participants in involvement. I want to remind everybody that at 4:30 this afternoon, we will have a full Spanish interpretation of this whole video. And we also will have an English replay if anybody, if your family or friends wants to watch it, 7 o'clock tonight on our channel, as well as it's on demand. If you want to just go to our website, wccc.tv, it's available on demand probably in the next 30 minutes or so. And one of the things that's not been mentioned quite as much as it normally is, we want to encourage everybody to get a flu shot. Flu shots are extremely critical, and we want to make sure that take that easy route and let's provide the support that these medical people need and not having to deal with the flu this year. And so that's a very critical issue. We do thank you for joining us. We'll find out whether we're going to be back next week since it's Thanksgiving. We'll talk about that in a minute. But we're glad you tuned in for this, and we hope you have a good day.